DSI Africa. On a video call, Roger sits in front of a webcam backdrop
Hello,
of a
I'm
house.
Roger Glass. I'm the director of the Fogarty International Center at the National Institutes of Health and the Associate Director for Global Health at NIH. And I'm delighted to host this panel as part of the launch symposium of the Data Science and Innovation Program of the Common Fund of NIH. We're very excited about this program, which will go on for the next few years, and we hope will be absolutely innovative to promote data science and innovation based in Africa, bringing in partners from the private sector, from government, from academia to advance this. This is a session today, Harnessing Innovation and Entrepreneurship for Data Science for Health. And we have 5 wonderful speakers, all of whom are in either academia, the private sector, or in government. So welcome to the symposium. Let's begin.
Andi sits in front of a wall with traditional African face mask.
Good morning, good afternoon. I'm Andi Gobin from Rice University.
Andi opens a slide presentation.
Thank you for the invitation today. Today I'm going to tell you about the NEST 360 Invention Education Program. Our ultimate goal is to expand and share our model of invention and entrepreneurship education with our African partners. Those include in Malawi, University of Malawi, the Polytechnic, the Malawi University of Science and Technology, Dar es Salaam Institute of Technology in Tanzania, and lastly in Nigeria, University of Lagos and University of Ibadan. We also have partners at Northwestern University and Duke University in the United States. The success of our program is based on the fact of building partnerships, not only partnerships with the institutions that we have, but the students, the faculty within those institutions and in the community from which they are part of. With that, building those partnerships not only between the institutions and components between that, us and the US, but also between the African partners themselves. So as I go through the presentation, you'll see that we focus on 3 different areas. The first of which is our student-centered approach. To start, we work with each institution to build a design studio into their campus. This provides access for both students and faculty and recent graduates, hands-on training, and the ability to build low to middle level prototypes. Within these design studios, we also have workshops. This is an image of one of the design studios at Polytechnic, where students have access to not only handheld tools, but also access to rapid prototyping tools such as 3D printers and laser cutters. In addition to the equipment that they get to use, we also provide an area where students can collaborate together, building both the communication and their teamwork skills. Another example of this is at DIT, where workshops are also held on things such as brainstorming, how to use equipment, needs finding. This gives students opportunities to really build solutions to real world problems. We also encourage faculty to use the design studios, not only also for their ideas, but encourage them to incorporate their design studio into the curriculum so that students can build solutions to the problems they're seeing in their classes. For our student-centered approach, we also have an 8-week summer internship. And what's unique about this internship is that we place students from each of our partner institutions all over the place. So for example, we have Malawi students going to Tanzania, coming to the US, and US students going to Tanzania and to Malawi. So it provides great opportunity for them to work on projects. They go out, they identify projects, they build medium level prototypes, and then present them. But one of the best things that I've learned from this experience is that students not only learn the necessary skills to build and design and think of solutions, but to build lifelong partnerships and friendships with the other students that they're doing. They get to share many of the experiences and realize that there are so many commonalities versus so many differences. Next, we focus on our faculty. And what we have found is that the best way to implement invention education into the curriculum is through faculty workshops. These workshops are intensive, typically will last between 2 to 5 days. And faculty not only learn new pedagogical skills, but also build a network and mentorship program amongst each other. Within these workshops, they learn things such as active learning. We go over syllabus and curriculum reviews, teamwork and communication, design processes, project scoping, and needs finding. And it's really exciting to see how they implement these new skills into their courses. We also have faculty exchanges, where within these exchanges, faculty will come to the US and partner with some of our faculty and be fully immersed into a course that we are teaching. This not only gives them an opportunity to see us implementing the same skills that we're teaching into our own courses, but get to ask those critical questions that they don't know or can practice. As time progresses, we actually will encourage more African to African faculty exchanges, where faculty will be able to learn what the other institution's strengths are, and then bring that knowledge back home to their home institution, emulate it, and share with their colleagues. Lastly, we provide workshops on entrepreneurship and innovation. And what's unique about this opportunity is that it is a 4-week process where both faculty and students and staff are encouraged to attend, and they learn topics ranging from IP protection to building business models. What I like about this program is that it's not just one person speaking to the audience, but we bring in community entrepreneurs, industry leaders, and folks who are involved in the innovation process within each country, so that students and faculty get to actually see some of the challenges and successes that happen within their own countries. So these workshops are very exciting. The students love to attend, and we've had many successes actually come out of this as students want to build a lot of their ideas out and build their own businesses. Lastly, I want to talk about the role of the community. The community comes in many different forms. We have partnerships with hospitals and clinics and other industries, but also innovation hubs and incubators to help build that pipeline as it moves from the university out into the local economy. We look for these partners to not only provide investors and actual entrepreneurs, but also to be involved in the education process, bring in their problems so that faculty can use it in their curriculum. To expand past our current African partners, we are helping to build libraries of faculty workshops so that anyone in Sub-Saharan Africa can actually see and use some of the skills that we're teaching, sharing knowledge on design projects that could be used in classes, and then also examples of lectures and curriculum. Lastly, we're partnering with professional societies such as the Biomedical Engineering IDEA Africa, the African Biomedical Engineering Consortium, and the African Engineering Education Association, which will allow us to share that knowledge across all of the continent. So with that, I would like to say thank you, and please visit our website for more information.
www.nest360.org. Gregory sits in front of a white backdrop.
Hello, this is Gregory Gamula and my colleague Theresa from Malawi, University of Malawi, the Polytechnic in particular. We are going to be sharing with you on the topic building an ecosystem of innovators, the Malawi experience. This is connected to a collaboration that another panelist, Andi, has already shared. Generally, found that the main aim of the project that we are collaborating on is to build an ecosystem that fosters innovation, improves health, and reduces poverty. Found that Malawi has a low manufacturing capacity, and as a result, found that most of the pieces of equipment that we utilize in the country in the various sectors are imported from outside the country. That has resulted in quite a number of challenges. And some of these challenges are that I found that at times the pieces of equipment are too complex to operate and maintain, but also I found that spare parts might not be really available in the local markets. Also, some of the issues like power supply, they seem simple, but at times they pose a challenge to the local setup. But also another issue is the different brands that are there for the same devices, such that we just have too many brands for a particular devices that also is a challenge on its own. Another aspect that is encountered is the challenges in the operating environments. You find that quite a number of these pieces of equipment are designed for a particular environment, but when they come to Malawi, you find that the temperatures, the humidity, the other aspects of the environment are different, and that poses numerous challenges to these pieces of equipment and such that they don't operate in the optimum way. Due to this, there is a growing need for low-cost, robust, and effective technologies that can be utilized to support advancements in technology. Engineering education in Malawi, until 5 years ago, used to be teacher-centered, whereby the all-knowing teacher would stand in front of the students who are ignorant and don't know anything, and he will actually deliver everything that he has acquired, and the students are just listening. But we know that this type of delivery doesn't engage a lot with the students, and as a result, very little learning takes place. And also I found that for issues of theoretical research projects, there are no proper supporting processes that are actually incorporated. In responding to these challenges, we found that as another panelist, Andi, already mentioned, curriculum review workshops were actually conducted with the aim of identifying gaps, enhancing modes of delivery, and also incorporating much needed issues of innovation and entrepreneurship in our curricula. Also, faculty development programs have been incorporated that are aimed at enhancing the skills of faculty such that they incorporate a lot of active learning in their delivery methods, as well as issues of problem-based learning or project-based learning and such. Also, we have students' internships that are incorporated to actually enhance the experience. Also, we've got a design studio that has been set up at the Polytechnic, which is equipped and has also materials to support innovation. But also we have seed grants that support promising innovations. We have also design competitions that are annual events right now, where innovations are showcased, and those that are impressive are given prizes. But also we have innovation and entrepreneurship workshops, both for faculty and students. Now, Theresa is going to take on with the presentation. Over to you, Theresa.
Theresa sits in a home office.
Thank you very much, Gregory. So within about 5 years of implementing the activities that my colleague Gregory has talked about, in collaboration with Rice University, we've already seen a huge shift in the way we deliver our programs in engineering, as well as the technologies being developed. For example, we have developed a phototherapy unit, which is used for treating jaundice in babies. This technology is available in all hospitals in Malawi, as well as beyond, for example, in Tanzania. It is low cost because it uses local available materials. It's durable, it's designed to cater for our harsh environments, as well as it can easily be maintained. We have also developed a cervical cancer screening device, which is low cost. and many more other technologies are in the pipeline. The other impact is that our faculty and students have been able to participate in various innovation fora, and some have won. But also faculty are able to apply for grants for enhancing activities in innovation. The other huge impact that these activities have had on Malawi is the response to COVID-19 challenges. As you are all aware, there's a huge demand for protective equipment to protect frontline workers, as well as supporting COVID-19 patients. The travel restrictions made the situation worse for Malawi. As my colleagues Andi and Gregory mentioned, that Malawi has a low manufacturing capacity and it imports most of the equipment from outside. So this called for locally designed low-cost technologies to address these challenges. And in response to these challenges, the Polytechnic assembled teams of experienced students and staff to start working on some of the much needed interventions in the design studio. The face shields were the first to be prototyped. As I speak, we have supplied over 10,000 face shields to various stakeholders, hospitals, private sector, NGOs, and donor agencies. There are other technologies also that have been prototyped and some are in use. So for example, we have manufactured face masks. We have developed a drone sample carrier, low-cost ventilators, portable solar sample cooler, pedal-operated hand-washing facility. As I speak, we have supplied more than 60 of these to various stakeholders. We have also developed a walk-through decontamination unit and a personal door opener. So a huge shift, a huge change. We are seeing technologies being developed. Nonetheless, we do have challenges. So for example, as I said earlier, there's a huge demand for protective equipment as well as other technologies. Yet the equipment that we have in the design studio cannot cope with the demand. So we need heavy duty equipment, for example, 3D printers and laser cutters, but also the other materials that are not locally available in Malawi that we need to use to advance the technologies. And we also need resources for the teams that are working on the technologies in the design studio. Thank you very much.
Robert has a backdrop of planet Earth. He begins a slide presentation.
Good morning. My name is Dr. Robert Karanja, and I'm really pleased to be able to join you via this forum, to be able to speak with you briefly about the role of academia in the knowledge economy.
The first slide reads, Welcoming the Knowledge Economy. A cartoon depicts 3 tombstones with RIP Service Economy 2008, RIP Industrial Economy 1975, and RIP Agriculture Economy 1929.
If you've never heard of the knowledge economy, believe me, it is very real. It is actually the largest means of creating wealth, creating jobs, and transforming the lives of people across the world. I think for us in Africa, it's something that we are still grappling with, but it is really not too mysterious and something that can be easily understood by anybody, including you and me. The whole idea of the knowledge economy is, what do we do with the knowledge we produce? Who produces the knowledge? It starts with academia, playing a key and central role in terms of understanding what are the challenges the society is going through and being able to come up with solutions for these problems. By so doing, the knowledge that is produced is then linked to the private sector through various mechanisms. We have various forms of technology transfer, know-how, through patenting, through copyright, through partnerships and actual consultancies with academia and others, publications and all of that. And we're basically able to then take this knowledge and start understanding, in partnership with the private sector, how do we translate it to impact? How do we reduce it into practice? And this happens across all sectors, whether it is the agricultural sector, or whether it is the health sector, or whether it is issues to do with the environment and climate change. We want to be able to leverage the knowledge that we are producing in our research to be able to ultimately impact the lives of our society, of our community. And the knowledge economy is the biggest way of being able to do so. So the big question is, how do we do it effectively? In Africa, we've not really been able to do so due to many challenges. We do not lack health R&D. We actually have significant capacity for health research, as you can see on the map on my left.
A map of health R&D capacity showing numerous locations of research output across Africa, from a paper by Nwaka et al. In 2010 in PLOS Medicine.
And there's also significant capacity for manufacturing, for being able to come up with products in order to be able to provide healthcare and other services on the continent, as you can see on the map on my right.
A map of industrial investments in Africa showing manufacturing activity in several locations in Africa, tracked by Trendeo from January 2016 to April 2018.
So what is the problem? The main problem is how we tend to most often use the words research and innovation interchangeably. The way I like to think about it is to really simplify it and remove a lot of the jargon. I basically look at what are the inputs for research. You start research by number one, receiving a research grant. You take in money. So the key input for research is money. And through the process that we call research, and this could be everything from the scientific method, how do you identify a problem? How do you formulate a hypothesis? How do you design a study, an experiment? How do you collect data? How do you analyze it? How do you extrapolate from it? All of this process, we call it research. And we basically spend the money, the research grant, in going through that entire process to generate new knowledge. Now, innovation, the best way to understand it is to think of it as the antithesis of research. It also starts with an input and ends up with an output. The input in this case for innovation is the new knowledge that we created through the process of research. And that new knowledge now needs to go through a process called innovation to ultimately create money at the end of the tunnel. Now, what is this process? What is this thing that we call innovation? And the best way to understand it is to look at it as a framework. Being able to focus on the inputs, being able to focus on the process, being able to ultimately arrive at the outcomes, and what context is all of this happening in. And in the health sector, we have what we call a health innovation system. And the best way to capture it, I think, is this diagram by Carlos Morel that basically looks at the role of R&D. And you can see R&D right here, where we do the research that we do. We look at issues to do with diagnosis, issues to do with treatment, issues to do with prevention, issues to do with the social determinants of health. And then we ask ourselves, so what does this mean? Have we invented something? Have we come up with a new drug, a new vaccine, a new diagnostic, a new medical device? How do we then translate that into a product that the patient can be able to access in the pharmacy, in the health facility? We can't do it alone. We do it through a public-private partnership and through the technology transfer mechanisms. And this is when innovation now starts to really become interesting, because industry will not come to us simply for the sake of wanting to learn about the research that we're doing. They're looking at it from the perspective of understanding, are you solving the community's problems? Are you solving society's problems? And if you're doing so, then their interest is really being able to understand what is the value that you're creating in this community? What is the value you're creating in this society? And that's what they call the market. And they're really keen on being able to understand how can they be able to deliver that solution to the market? How can they create value in that market? And how can they capture a piece of that value? And that is how ultimately you end up with money. That process of being able to take it from a situation where we're talking about the prevalence of a disease to understanding what is the market size and how do we capture a slice of this market? What is that in monetary terms, be it in the US dollars, be it in the Kenya shilling, be it in the US, in the South African rand, or in the Nigerian naira. We are all looking at it from the same, with the same intention, but it's two different sides of the coin. But they do need to work together cohesively in order for the whole thing to come together. But and this is quite an effort, and it requires understanding other innovation actors. The government is a regulatory actor. The market in itself, we talk of the laissez-faire, it is an important actor. Our rules for being able to operate and to play fairly, intellectual property management, for example, is critical. What about the STEM, the role of STEM in terms of our youth, or our workforce? Is it being trained well? Is it able to understand sciences? Is it able to understand engineering, to be able to do all of these processes? And ultimately, the entrepreneurial talent, to be able to see an opportunity, to be able to harness it, and to be able to create jobs, even as we create solutions. So all of this happens within the health system. So issues to do with adoption of technology, issues to do with access by the patients to these technologies, issues to do with affordability, distribution. But if we're able to get it all right, then we start to see Africa emerging from a vicious cycle of poverty that causes disease, and disease that then leads to more poverty. But we start to build a virtuous cycle of doing research, coming up with solutions creating jobs, those jobs creating wealth, the wealth creating empowered citizens that are not falling sick due to issues that they are now better able to control. They're able to choose where they're going to live. So the social determinants of health start being addressed. They're able to take up things like insurance. So they're able to proactively seek care and be able to catch health issues much faster rather than delayed access to healthcare. So this virtuous cycle is basically what we want to be able to achieve within the knowledge economy, within this context of the DSI, so that we start looking at Africa and saying, how do we achieve health improvement? How do we achieve economic growth? And there's a lot of opportunity for us to be able to do so, but it enables us to be able to understand innovation and the whole process of innovation. And that at the heart of it, you'll always find these three key partners. The first one is the government, who sets the agenda, who is able to regulate and not only set the agenda, but also set the rules. And then you find academia, who is able to generate new knowledge, solve problems, understand what is it that is creating a challenge for us in the health system. What is it that's ailing us, whether it is COVID-19, is it malaria, is it HIV? And then the private sector that is able to see the opportunity, that is able to take that problem, understand the challenge, and also, but able to look at it and flip it into an opportunity for investment, for creating jobs, for creating wealth, for being able to achieve better healthcare. And this is also not possible, especially in the early stages of innovation, without intermediary organizations. Organizations like Villgro Kenya, venture capitalists, angel investors, the entrepreneurs themselves that may not be able to understand science. So our ability to speak to them, to understand their languages, to be able to understand how best can we meet each other in the middle, so that we're then able to have a meeting of minds and an exchange of ideas and a cohesive synergistic effort in order to ultimately make all the boats rise together. So we have an amazing opportunity when we're talking about DSI, because DSI is really talking about digital innovation. And digital innovation in health is very close to my heart, because this is an area that we are almost all at the same level. But I think for Africa, we do have some amazing advantages that can enable us to really take advantage of the fourth industrial revolution far much faster and in a cheaper way than other countries that have already invested in older technologies. When you look at COVID-19, for example, telemedicine is really coming to the front. For us on this continent, we realize that we do have a severely underfunded health system, but being able to work without it, outside of the confines of the brick and mortar of the health system, is a huge plus. This means being able to leverage Internet of Things, being able to look at wearables, being able to look at big data, cloud computing, and all of these amazing things, machine to machine communication, machine learning, artificial intelligence. So there's a lot of opportunity and so many ways that we can be able to deploy this within the health system that can enable us to really start creating this virtuous cycle research that is leading to new knowledge, that is leading to opportunities to move faster with a lower capex and start to solve the health challenges of this continent, creating jobs and creating wealth, and ultimately building a prosperous and healthier population in Africa. With those few words, I want to say thank you so much for your time, and I look forward to a very engaging and stimulating discussion. Thank you.
Chacha sits on a sofa in front of a white wall.
Good afternoon. My name is Chacha Marwa. I'm a co-founder and managing director of Enzi Health Limited, which is a last mile health management organization that focuses on healthcare financing, delivery, and preventive care all in one continuum. How do we do this? We do this through what we call the 3D strategy. And in the 3D strategy, we focus on decentralization of primary healthcare. We also look at democratization of primary healthcare and disease surveillance, as the strategy entails. We did this because we realized that that people needed healthcare at their home, and there were very many reasons why people were not accessing healthcare. That is that they needed at the time when they were sick. And so we one of the things was that we found out that many times people would self-medicate. Many times they would go to herbalists and other people, and that's because of the other costs of healthcare that are not directly related to the cost where you go to see a doctor and you pay. So the cost of transport, for example, the cost of inconvenience of going to a facility, and all that were things that many people considered that were not in the purview of many people who are delivering healthcare. So we then designed a method where we could go to people's homes, collect information from them through a medical device that can test up to 60 different tests, all the way from ECG to malaria to typhoid to blood grouping and all that. So this device is a small device that is about a kilogram, and it connects to a mobile phone, and so we can go and deliver healthcare right in the living rooms of Kenyans. So that is how we do the decentralization of healthcare. Then we have the democratization, where we encourage many people to connect onto our platform. And this we do through an agency model, where we encourage the small scale business people to enlist or enroll people onto our platform. So the kind of data that we are able to capture is financial information. We're able to get social, economic information of our clients. We're able to get disease patterns of these people. We are also able to geolocate them. So once somebody hails our service, then we have machine learning. So we are able to locate that place. And then the next person who hails from there helps us to redefine our mapping, so that the next experience of hailing as we are taking care is much more efficient and much more, it's much more better. In terms of the third D, which is the disease surveillance, we look at, we map out the diagnosis and the prescription and the diseases. So all that is information that we have. So over time, we hope that we can have what is called precision medicine, where we can be able to almost ascertain certain symptoms and diagnosis and the prescription, the eventual prescription, and possibly the kind of treatment outcomes that we expect. So we are doing this. We have a lot of machine learning and deep data learning that we are doing all as we go along, so that we could be able to then have this to be an easier way of being able to deliver healthcare in people's homes. We do also expect to have this model as an easier way to scale, as opposed to the normal brick and mortar model. This is an easier one that you can be able to just put it on the back of a clinician, and then they get the hail and healthcare is delivered. One of the things that we have found is the disconnect between what industry needs and what the academia have. So the academia have a lot of information. They are able to churn out they are able to digest a lot of this data that we have, and yet there is that disconnect between the two. And one of the things that we hope to be doing in the future is to have that cooperation between the academia, the industry practitioners, so that we can then make the patient experience much more meaningful through the use of data science. Thank you very much.
The video call returns to Roger.
Wow, wasn't that a terrific panel, and what outstanding speakers, what innovation there is in Africa and what opportunities lie ahead. And that presentation about academia and how training has changed from being a direct professor delivering a talk to getting young people engaged in the opportunities. It was very exciting to see the creation of an ecosystem for innovation and health. With that, we're going to open this session to questions from the audience, from you who have experience or interest in these amazing topics and this innovation that's been demonstrated by the panelists. Please stay tuned for the interactive session.